Yeah, hi everybody. My name is Dr. Cary Gans, and I'm a dentist here in Garden City, New York, right across from Roosevelt Field and the Neiman Marcus here on Long Island. And I do these little Facebook Live things when I have a couple of minutes in between patients, and I like to report on things that happen during my day. So what I want to talk to you about today is swallowing a crown or a bridge. Now, I'm doing dentistry a long time, and for the most part, I think I've only had one patient actually swallow a crown, and it was a single crown. Now, what do you do if that happens? Well, first, if you're the dentist, the first thing you do is try to calm the patient down, letting them know that typically a single crown will be passed. They may have to go look for it, but it will be passed, and it's usually not a dangerous event. If it's not passed, then they need to speak to their physician and find out what the next step is. Very often it's either a CT scan or an MRI to find out where that restoration, where that object is, so that if necessary, if it's going to cause a problem, they may have to go after it. Now, the problem that comes in here is when this procedure is not followed. Now, this is going to be a real short video, so I don't know how many people are really going to listen to it. But if you do swallow a restoration, it's not the end of the world, but it's also not something to be taken lightly. The bigger the restoration, obviously, the bigger the problem. Now, another area of concern is that if you happen to do it while you're sleeping. Doesn't happen very often because typically the gag reflex will stop it. But if indeed you do swallow or do something in the night and during the evening while you're sleeping, or even worse, if you aspirate it, if it goes into your lung, into your trachea, etc., this is not something to be fooled around with. You need to call your dentist or call your physician and have it attended to. This unfortunately does not happen very often. Most patients go through all their dentistry all their lives and never have a problem with it. But just today it happened, and with this lady, we had to take care of her, and well, hopefully it'll all go smoothly, and she won't have to have any kind of procedure done. But one never knows, and certainly it's not something you leave alone and just forget about. It's up to the dentist to guide you. It's then up to you to speak to your physician, and do whatever they tell you to do. The other point is when the dentist is working in your mouth, please don't talk. I know we all tend to do it. Or dentists are even worse. They ask you questions. Do it myself. But what happens is when we're working in your mouth, if your tongue moves, that's when these things can typically happen. Because you knock into our hands, we're working with small objects in a little 4-inch circle called the mouth. Your tongue hits it, our fingers drop. We now all wear gloves, so our tactile sensation is not as great as it would be if we weren't wearing gloves. That's when these things happen. So if you need to talk, raise your hand, groan, moan, or something, and just let us know, and then every dentist will just stop at that point and let you say what you have to say. But try to keep conversations to a minimum when we're working in your mouth. That'll go a long way for this to stop happening. Another thing you can do to prevent this is if you have restorations in your mouth that are only temporarily cemented. This could be implant crowns, which in our office we typically only cement implant crowns temporarily. There's a reason for it, which I won't bore you with. Or maybe a temporary cap. Or you may have been eating something and a cap comes loose that's been in there for a long time. You put it back in, and then, without thinking about it, comes out and you swallow it. So best thing to do is if a restoration is loose, you let us know. We as your dentist will go ahead and take care of it. If it's something that's in your mouth with temporary cement, chew on the other side. Stay away from it if you possibly can. And that's just good common sense. Hope this makes sense. It's just something I thought happened today, and I thought it would be a good thing just to throw out into the ether, as they say, or out into the cloud. So if you do have a restoration, just be careful. Take care of it, and everything will go along pretty smoothly. Any questions, you can always reach me at my office here in Garden City at 516-741-1230. Once again, Dr. Cary Gans. Have a great day, and it's July 4th weekend, so have a great July and safe July 4th.